Fejzo.
Hey, how are you?
Hi, so nice to have you. Thank you so much for joining me.
Sure, sure.
I'm super excited to have you here. I can't tell you what an honor it is for me to meet you as somebody who has survived hyperemesis 2 times, 2 pregnancies. I have been following your work for since my daughter came into this world 6 years ago, and this past year, I was very lucky enough to be part of your research at Harmonia Health. So it's really an honor. It's really an honor.
Well, thank you for participating.
Yes. Would you please tell me a little bit about hyperemesis gravidarum for those who don't know much about it?
So most people have some nausea and vomiting in pregnancy, but this is really at the very severe end of the clinical spectrum. So the worst 2%, or could vary, be a little more or less than that, but it's very severe nausea and vomiting of pregnancy that affects your daily routine and affects your electrolyte levels. So you uh, generally require intravenous fluids because you get so dehydrated,
Hmm.
and it may lead to weight loss, usually leads to weight loss, and instead of weight gain in pregnancy.
Hmm.
And patients generally require medications, like I said, fluids and uh, support.
Yeah, yeah, that's exactly it. And just a little bit about my experience. I had hyperemesis extremely severely. I had it start at 4 weeks and it lasted all 9 months of my pregnancies. I lost 70 to 75 pounds
Wow.
and I was hospitalized for all 9 months. I had kidney infections due to dehydration. I had every medicine you can think of from Zofran to Clergus, Phenergan, intravenously, nothing worked. And it was me fighting for my life and fighting for my baby's life. But by some miracle, my 2 babies were healthy, and I was one of the very lucky ones, I think, because not many women can say the same.
Yeah, that sounds terrible. I wouldn't call
Yeah.
you lucky, but it's
Yeah, it was definitely a crazy out of body experience, and I think the first time around was a surprise because nobody knew what was going on. I didn't actually get diagnosed until I was 5 months pregnant, because no OBGYNs wanted to have me as a patient. They didn't understand what was going on. They didn't want to diagnose me with hyperemesis. So I knew from day one that that's what I had, just from my own research, and it was really upsetting that I had to diagnose myself and find ways to alleviate myself. Yeah, it was scary.
yeah, that's very disappointing because we've been working with the Her Foundation for years to get the word out, and yet
Yeah,
people are still treated the same way that I was many years ago. So,
yeah. I think in the last um, 2 years or 3 years since my son was born, um, I will say from experience, things have been better. My second pregnancy, I got immediate help. I had at home care. I got disability insurance. So I think that it's the word is getting out and information is being spread thanks to you and your findings. Um, can you please explain a little bit about GDF15 hormone?
yeah, so we first identified a genetic link between GDF15, which is a nausea and vomiting hormone, and hyperemesis. And everybody has GDF15, whether you're male or female, and whether you're pregnant or not.
Mm,
But it goes up very rapidly. It's produced by the placenta during pregnancy, uh, and causes nausea and vomiting. But uh, people have it before pregnancy as well. It's basically what we think is a signal to tell the body that it's better to rest and recover than to go out hunting for food back in
Hmm.
ancient times.
Yes.
So basically, anytime your body is under any physical or mental stress, we think that this hormone rises to tell your body that you are more likely to, not survive if you go out hunting for food back in the time when it was very dangerous. You
Wow.
were weak in some kind of weakened state from some illness or infection. Uh, then you are going to be more likely to get, eaten by a lion or something like that. And so your
Wow.
body is basically telling you rest and recover, don't go out searching for food. And so it's something that we really don't need anymore, I don't think. Now we
Mm-hmm.
can just push Uber Eats on our phone and click a
Yeah.
button. It's not
Food
so
is so
dangerous.
accessible to us. Yeah.
Yeah, it's not so dangerous anymore. Our food is safer. But it's something, that we haven't evolved out of yet.
Mm, interesting. So, you found that there are some women who have high levels of this before pregnancy.
No, so it's actually the opposite. So, which
Oh,
is
okay.
surprising to us. So we thought it would be higher levels because they have higher levels during pregnancy. But what happens
Hmm.
is that the women that are genetically predisposed to hyperemesis, they have abnormally low levels before
Mm,
pregnancy. And so when they get exposed to that rapid rise during pregnancy, they're more likely to be very sensitive to it.
hmm.
So we found that um, that the cause of nausea and vomiting and severe nausea and vomiting is a combination of that low level before and then high levels during pregnancy, and your sensitivity to it.
Wow. Wow, that's incredible. When did you know that you wanted to start looking for the cause of HG? What inspired you to dedicate so many years of your life to finding out more about HG?
Yeah, so like you, I had very severe hyperemesis. I was completely bedridden. I could not eat, drink, or move without violently vomiting.
Mm,
Like you, none of the medications helped me. My doctor put me on 7 medications at once. I did get home IV fluids, so I didn't die, but I didn't keep anything down for over a month before my doctor started me on tube feeding, and I think that was too late. And so I lost the pregnancy in the second trimester.
oh,
And so during that time, my doctor told me that I was exaggerating my symptoms for attention. I was too weak to fight that. I couldn't even speak at one point. I got so weak that I had to use a buzzer to signal that I needed, a change in my medication or things like that. Um, and so I decided after I recovered to research it myself. I do have a PhD in Harvard, from Harvard in genetics and medical science and in women's health. I found the first genes for uterine fibroid tumors, so I was already interested in focusing on women's health problems. And so I decided to pivot and work on hyperemesis and find the cause myself.
wow. And around what time was that?
So that was, I lost the baby in 99, and then it was really right after that. It's a very long process to get to where I am today,
Yeah,
obviously.
yeah, I can imagine. And back then it was like HG didn't even have a name to it. It was just non-existent. So I can't imagine how hard it was with the medical community. How did they respond early on when you were trying to look for just answers for HG? Did you feel supported? Was it kind of dismissed?
Yeah, it was dismissed. I couldn't get support. I just kind of had to march on the sidelines. I had a job at UCLA doing cancer research, ovarian cancer research mostly, and just sort of worked on it on the side.
Mhm.
I partnered with the Hyperemesis Education and Research Foundation, the Her Foundation, and we worked together to first post surveys to try to answer some of the questions that we had and that most people have with hyperemesis,
Mhm.
and get evidence that it might run in families and the high recurrence risks so that we could show evidence that it might be genetic. And then I started collecting the DNA samples, but it still was very difficult for me to get funding to sequence the DNA samples.
Right.
So yeah, it was a long road.
Wow, yeah, I can imagine, but it was so worth it. It was so worth it. And where did you find like the power and just the will to just keep going, to keep going? I would imagine you had a lot of women come to you and be like, "Thank you so much for taking the time to do this." Maybe that's where your inspiration came from and also your own experience, of course.
Yeah, those words of encouragement definitely and gratitude definitely help. And there are definitely always setbacks, but I just sort of always give myself the day to be angry or upset when things don't go right, and then just get up the next day and start again and find a new way to get things done. So, uh, yeah, I mean, and it's
And
just,
you're a mom now, so you also have, your reasons, they are your why for everything that you do. I feel like as mothers, we just have that immense power in us to fulfill and find answers, to make sure that our kids have answers to whatever it is that they may inherit, right?
exactly. Yeah, I would be devastated if I didn't do everything I could, and I have to see my daughters going through this. So, uh, yeah,
Yeah.
I hope that we'll be there before that happens. So,
Yeah, exactly.
I'll
And
take my
thank you for doing that for my daughter too, because that's been a huge fear. Now that I've know so much about HG and I've done a lot of family research in my lineage, I've come to realize like, wow, my mom's sister, my mom's cousin, my grandmother from my father's side all had HG, but didn't know that that was what they had. So knowing that, I'm like, wow, okay, so there's a chance that my daughter could have it, but we are so many steps, years forward from where they were and doing the work that our ancestors would have loved somebody to have done for them, to speak for them, to advocate for them. We are doing that. So thank you so much for everything. Um, in your research, have you found any connections between HG and other conditions like PTSD, anxiety, trauma,
Yes, all those things.
right?
So, yeah, so one of the problems is that doctors always found it short-lived. Not in most people, nausea and vomiting, normal nausea and vomiting goes away, but for people with HG, it can last like yours did for the entire 9 months. So, um, it can lead to increased risk of trauma from, 9 months of starvation and the dealing with fighting that terrible nausea every day and having to make the difficult decisions of taking medication in pregnancy, of unknown effectiveness and safety, and knowing that you can't eat properly to grow your baby. It's a very stressful situation for pregnant women, as you know, and so that can definitely lead to trauma. And so there is an increased risk of PTSD following HG pregnancies, especially for those ones that last 9 months.
Mm-hmm.
There was a study, not mine, but another study that looked at postpartum depression models and found that it was one of the four top predictors of having postpartum depression following HG pregnancies, which is not surprising. Um, So, it's associated with preterm birth. And also, now that we can link the hospital records of the child to the mother's pregnancy electronically, studies are coming out showing the long term effects in the child, even smaller brains at age 10. So, um, yeah, it's not surprising since these women are really starving in their pregnancy. Um,
Yeah,
but now we have evidence for it. So,
that's amazing. It's validating and a relief to know that we can now have, the receipts, for lack of a better term, regarding all of that. But is there anything promising on the horizon in terms of treatment and early diagnosis?
yeah, so definitely some promising news. So, like I said, we found that women with hyperemesis who have this genetic predisposition or otherwise have lower levels of this hormone during pregnancy. We did a study, this was on animals, that came out in our recent paper that showed that if you gave the mice a high dose of GDF15, similar to what they are exposed to in pregnancy, um, that they have that response that you would expect of lack of appetite and weight loss. But if
Mm,
you gave them a low dose of the hormone prior to the high dose, they could be desensitized to it. And so that was done by Dr. Stephen O'Reilly in University of Cambridge. And it was really exciting because it suggested that maybe we can desensitize women to this before pregnancy. So
mhm,
the next study that I've done that is coming out in the American Journal of Obstetrics and Gynecology. It's already, the preprint has already been posted, so I could talk about it. Is a study that we did on metformin prior to pregnancy. So, metformin is a drug that is already used in that prior to pregnancy period to help improve fertility in patients with PCOS.
mm.
And so we already know that actually it increases the level of that hormone GDF15. And it's available in generic form. So we did a survey study. So it's a retrospective study where we asked people whether they used 32 common medications prior to pregnancy and substances prior to pregnancy daily.
Mhm.
30 days prior to pregnancy. We didn't tell them that we were interested in metformin so that it wouldn't be biased. And then we
Mhm.
asked them how their nausea and vomiting was during pregnancy. And what we found was really phenomenal. It was better than I
Oh my
expected. There was
gosh.
70%
That's
reduction
amazing.
in the risk of hyperemesis in the first pregnancy, 80% reduction in risk in the second pregnancy. So, it's not going to work for everybody. It was not
Mhm.
100%, but that is strong evidence that pre-treatment with metformin in those people that had a history of hyperemesis who are trying to conceive may help them to lower their risk of getting hyperemesis in the next pregnancy. And so the next step is to do a real clinical trial to try to. There's still things we don't know. That was just a survey. We just asked
Mhm.
metformin. We didn't ask what kind of metformin. There are different kinds. There's one that has a better safety profile, which is metformin extended release that doesn't cause as much nausea and vomiting. And there and how long they took it before and when they stopped it. So these are some things that we need to figure out with an actual prospective trial where we give it and then see what happens. And so that's the next step, but it's looking very promising. So yeah, I'm very excited about that. And then I'm also partnering with a company, NGM Bio, that has a antibody that blocks. So it's a drug that blocks the action of the hormone, and they have actually treated, they started the trial in February and have actually treated patients. It's not in the US, but it's started in the UK and Australia
Mm.
with this drug. And they are testing it in hyperemesis pregnant,
Oh,
women with
wow.
hyperemesis in
Oh,
pregnancy.
they've started already.
Yeah, they started in
Wow.
February. So, um, yeah, so that's really exciting as well. So the because the metformin is mostly, I would guess, and at first at least, only going to be useful to people who've already had it, who are scared to conceive again, which is very common for people who've been through it once. But for people in their first pregnancies, we need something for them as well. So yeah, so that both a way to block it during pregnancy and a way to desensitize you to it before pregnancy are now on the horizon.
Wow, that's so amazing. Congratulations on those findings. And I can't tell you like what doors that opens for me because I said after my son, I was like, no more kids. Like, I don't have a choice. But now there is a choice. I do have a choice. So that's so exciting. My husband's going to be very happy.
So hopefully these are still in progress, but yeah,
Yeah, that's
looking good.
so nice to hear. Thank you for sharing that. How can listeners, especially moms who've experienced HG, support this work or advocate for more awareness and research?
Thank you. Yeah, I mean, everybody can do something, whether it's financially. There is a link to donate to the metformin trial at USC. You can donate to research through the Her Foundation, or if you don't want to donate to research, but just don't want to if you want to donate to the Her Foundation, they do amazing work for advocacy, for research, and for all sorts of things. They have a online support group. So yeah, definitely suggest that moms going through it, if you haven't heard of the Her Foundation, to check it out. It's hyperemesis.org, and they have many ways that people can help. And then just going and telling your story, going even just telling your doctor if you're going through it now about the recent research. OBs are really busy and they don't always have time to update themselves, and so
Hmm.
go to the Her Foundation, print out the latest research, and spread the word to your doctor, your nurse practitioner. Tell your story to your friends to increase awareness about it. Like you said, you didn't know about your family. A lot of people just don't talk about it, and so talking about it helps as well. So there's lots of ways to help spread the word, and every person counts.
Yeah, exactly. And that's why I started the Hidden Hues of Motherhood. That's the biggest hidden hues were my pregnancy and what I experienced. And I said, somebody needs to hear my story. Somebody needs to hear about hyperemesis. And I have been so lucky to help about 5 women in New Jersey who have experienced hyperemesis during the pregnancies, and I've advocated for them. I've, given them the tools and the language and the advice that they need, just to make them feel like they're not alone. So it's been really nice, kind of advocating for women with HG and spreading awareness for it, and doing it through my platform, and now in person, also doing speaking engagements. So it's just, yeah, I look forward to doing more of that.
Yeah, that's great. I mean, yeah, everything helps. So I really appreciate that.
Yeah. Thank you so much. If you had a magic wand, what policy or system change would you make first for maternal health care?
um, just, I mean, more funding for research in maternal health is the main thing. It's gotten so little funding, and if the funding is there, people will work on it.
Hmm. Yeah, and I'll link some, have some links here for people so that they know where to go for resources, and also where they can help and help you with your research as well. Is there anything else that you'd like to tell mothers who think they might have HG or who know they're experiencing HG or who had HG?
Yeah, I just highly recommend going to the Her Foundation website. The website has so much information on it, and a lot of people just use social media now and ask questions that are just the answers are already on there, so you can
Mm-hmm.
find out a lot just by going to hyperemesis.org. I recommend that patients going through it talk to their doctor about thymine to avoid the rare but very dangerous outcome that still keeps occurring. It's rare, but it still keeps occurring, which is a kind of a swelling of the brain that occurs in some women rarely that have hyperemesis that can cause brain damage and is so avoidable with a thiamine supplement. So that's another thing that I strongly recommend.
That's incredible. Thank you so much for that. Oh, Dr. Fejzo, it's been amazing speaking with you, getting all this information from the person who has been dedicating her life to finding these answers. I can't thank you enough for being on HHM podcast, and I'm so excited for everybody to hear your story and to hear your findings.
Thank you for having me, and thank you for helping spread the word. It's so important.
Of course, it's so nice to meet you. We'll
You
stay
too.
in touch. Thank you.
Thanks. Bye.
Bye.